Hello and welcome to the 2021 Open Enrollment Employee Webinar. My name is Melanie Denning from the Healthcare and Benefits Division, HCBD. The purpose of today's webinar is to educate employees regarding the 2021 Open Enrollment period and state plan changes that will be implemented on January 1st, 2021. This information is provided so you are prepared to complete your open enrollment elections by the deadline and understand details for the 2021 plan year. Let's get started. If you have questions after this recorded presentation, please contact HCBD either by calling us at 800-287-8266 or by emailing us at benefitsquestions@mt.gov. Employees will receive numerous communications from HCBD regarding open enrollment. There will be postcards mailed, posters, open enrollment booklets mailed to employees' home addresses, reminder emails, and employees will have the option to participate in 4 employee Zoom webinars. This recorded version of the webinar will be available after October 12th to access at any time on the HCBD website. Open enrollment booklets will also be posted online. All information necessary for open enrollment is available at www.benefits.mt.gov/open enrollment. Employee Zoom webinars will take place Tuesday, October 20th at 10, Wednesday, October 21st at 9, Thursday, October 22nd at 1 p.m., and Thursday, October 29th at 9 a.m. If employees cannot attend one of these scheduled online Zoom webinars, there will be a link in the open enrollment website, www.benefits.mt.gov/open enrollment, to the recorded webinar that may be viewed at any time. The webinars are not being presented this year by using Zoom. If you have any issues connecting, you should contact your agency IT department. Employees are not required to pre-register for any of the webinars, and closed captioning is only available on the pre-recorded webinar. Before we get into the open enrollment details, we wanted to provide some reminders regarding the State of Montana Benefit Plan, or State Plan. The State Plan is self-funded and is funded by monthly employer, employee, legislator, and retiree contributions. Contributions are held by the state plan and then used to pay state plan expenses, the vast majority of which are claims for services incurred by our members for medical, prescription, and dental needs. When you balance our income with our expenses, you get the state's plan reserve. State plan reserves are needed because we can't control all the variables surrounding operating the state plan. We can control many of our plan costs, but there are some things we don't have direct control over, including our largest income source, which is the employer contribution. The employer contribution is set by the legislature every 2 years. HCBD provides funding recommendations, but ultimately, we have to comply with the funding that is set by the legislature. The employer contribution hasn't changed in 4 years and is not planned to change in 2021. Federal mandates also directly impact state plan expenses. For example, in 2018, the state plan was required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Care Act, or ACA. In addition, due to recent changes to mental health parity regulations, the state plan has also enhanced some of the coverages available for behavioral health and addiction treatment services. HCBD works hard to estimate and evaluate expenses so that we have a general idea of volume of claims every year, but there can be surprises. Medical trend, the increasing cost of medical care are both huge variables that the state plan has little control over. It can be difficult to predict. The cost of medical procedures and prescription medications continue to rise year after year. The state plan needs to always have enough money in the reserves to cover all 30,000 plus members when they need us. The state plan continues to implement innovative solutions to address the ever-rising costs of healthcare. These solutions include reference-based pricing, partnerships with best-in-class vendors such as Navitas Healthcare Solutions, and the implementation of new value-based programs such as medication therapy management and the remote blood pressure management program. These ensure the state plan can continually maintain state plan benefits and contributions. Our strategies have been successful in allowing state plan to control costs, effectively manage the plan, and improve health outcomes for the members. HCBD will continue our efforts to control costs and manage the state plan, continuing to work with Montana hospitals and other partners to address the rising costs of healthcare on behalf of all state plan members and the taxpayers of the state of Montana. As a result of HCBD's efforts, we're excited to announce the employee contributions will not increase for 2021. This also applies to retirees and legislators. The employer contribution will remain the same for 2021. This is the 5th year that employees have had no contribution increase. This slide reflects the medical, dental, and vision hardware rates for 2021. Again, there is no change to these rates for 2021. This slide is a general cost information slide about flexible spending accounts, life insurance plans, and long-term disability. On this slide, I'd like to point out that the medical FSA or flexible spending account contribution maximum has increased from $2,700 to $2,750 for 2021. In addition, the medical FSA rollover amount has increased from $500 to $550 for 2021. This information is included in the open enrollment booklet that will be mailed to all state of Montana employees in mid-October. In addition to no contribution increases, there will also be no change to the medical plan out-of-pocket costs. This means that medical plan copays, deductibles, and maximum out-of-pocket costs will remain the same for 2021. You can refer to the Employee Open Enrollment Booklet, the HCBD website, or the WRAP plan document for additional state plan coverage information. Don't forget that you can get a 3-month supply of your maintenance medications at your local retail pharmacy or at a mail order pharmacy. Maintenance medications are medications that are used to treat chronic long-term conditions. For example, diabetes, high blood pressure, asthma, etc. Schedule 2 or Schedule 3 prescription medications, which are narcotics, are limited to a 34-day supply. To get started, just request that your prescriber write your prescription for the 90-day supply. Then you will receive a 90-day or 3-month supply and only pay 2 copayments. Most participating in-network pharmacies can dispense the 90-day supply, but you may also get a 90-day supply through the state plan mail order vendors, and these are Costco, and you don't have to be a Costco member, MyRx Pharmacy, or Ridgeway Mail Order Pharmacy. Effective January 1st, 2021, the state plan is implementing a tobacco surcharge for plan members who use nicotine. The surcharge will add $30 to the monthly contribution amount for those employees who use nicotine, and an additional $30 per month if the employee's covered spouse or domestic partner uses nicotine. The tobacco surcharge is a separate surcharge and is not the same as the Live Life Well incentive. In order to earn the Live Life Well incentive, plan members must follow the instructions found at www.benefits.mt.gov/incentive, and you must self-report the nicotine status at www.myactivehealth.com/SOM. This important change, the tobacco surcharge, means that in order for you to avoid having an additional unexpected monthly cost added in your 2021 out-of-pocket contribution, you must complete your open enrollment elections this year. When completing this year's open enrollment elections, you will be required to indicate if you're nicotine-free or a nicotine user. Definitions of nicotine and nicotine-free are shown on this slide. Nicotine is the addictive stimulant proven to have negative health effects that's found in cigarettes, cigars, chewing tobacco, and most vaping products. Nicotine-free means that you have never used nicotine, you've quit using nicotine, or you infrequently use nicotine, such as less than 4 times per month. You are nicotine-free if you're currently using nicotine but have completed an eligible alternative, such as a nicotine cessation program or a nicotine counseling session with a medical provider in the last 12 months. The definition of a nicotine user is, a nicotine user is if you are currently using nicotine and have not completed an eligible alternative, such as nicotine cessation program or nicotine counseling session with a medical provider during the last 12 months. During the open enrollment election process, you will need to indicate yours and, if applicable, your covered spouse or domestic partner's nicotine status. Failure to complete your open enrollment elections will result in you and, if applicable, your covered spouse or domestic partner being automatically charged the nicotine surcharge. Action is required this year. This slide shows the tobacco surcharge question that's asked during the online open enrollment election, and it's also included on the printed election form. Again, it's imperative that you complete open enrollment elections for 2021, or you will be automatically charged the tobacco surcharge for yourself and, if applicable, your covered spouse or domestic partner. During the open enrollment elections, you will either choose, yes, you are a nicotine user and be charged the $30 monthly tobacco surcharge, or no, you are not a nicotine user, and the charge will be waived. If you have a spouse or domestic partner covered on your medical plan, you will be prompted to answer the same question for your spouse or domestic partner. And if you answer yes, there will be a $30 monthly tobacco surcharge for the spouse or domestic partner. The employee contributions are outlined in the Employee Open Enrollment booklet. The booklets will be mailed in mid-October, and these booklets have also been posted to the HCBD website at benefits.mt.gov/open-enrollment. On the web page, you may also locate the 2021 employee rates by clicking on the Resources drop-down menu, Rates, and then clicking on 2021. More information regarding the tobacco surcharge can also be found on the HCBD website under the Resources drop-down and clicking on Tobacco Surcharge. Again, this year, we're providing members with this reminder. State plan members cannot use the state plan, including the Montana Health Center, for any work-related injury or illness. If you or anyone covered on the state plan, including dependents, gets hurt or sick while working, the state will not provide coverage, even if you have a work comp waiver. As a state of Montana employee, you are covered by workers' compensation insurance. For example, if you or a covered dependent own a small business or a working farm or ranch that earns a profit and you're injured while working, you may not submit claims to the state plan and cannot use the Montana Health Centers to treat the injury. Please make sure you and your covered dependents have proper insurance coverage in place to cover work-related injuries. The vendor for the state of Montana's flexible spending account is ASI Flex. The medical plan FSA limit for 2021 will be $2,750, which is a $50 increase over 2020. Participants will be able to roll $550 from the previous year, 2020, to the next calendar year, 2021. This rollover does not require a 2021 medical flexible spending account election in order to use the rollover amount up to $550. The dependent care FSA limit for 2021 is $5,000 per household. We continue to have employee confusion in regard to the difference between medical FSA and dependent care FSA. The dependent care FSA enables you to pay for out-of-pocket, work-related dependent care expenses. It is not used for medical-related expenses for dependents. As a reminder, you must re-elect coverage during open enrollment for both flexible spending accounts in order to participate in flex spending in 2021. Also, there's no debit card fee with ASI, and everyone who makes an active FSA election for the medical FSA plan will receive a debit card. When participants use the debit card to pay for FSA-approved expenses, there are IRS regulations that require the participant to provide supporting documentation to show the actual date of service, patient name, and description of the service. This is not a new requirement with ASI, and it is an IRS requirement. The debit card will remain valid until the card expires. If the employee terminates their FSA and then re-elects FSA during another open enrollment period, the card may still be valid if it has not yet expired. When you decide to retire, you have the option to stay on the state plan if you're eligible. However, there may be lower cost alternatives outside the state plan coverage, and we encourage you to review your options. You and your dependents may also elect COBRA coverage, which will extend coverage for 18 months. We will cover this in more detail on the next slide. One of the alternatives for non-Medicare retirees is the health insurance marketplace at www.healthcare.gov. For Medicare retirees, Medicare supplements might be a lower cost alternative. For more information on the alternatives, employees can contact a state health insurance program officer or SHIP representative in their area by calling 800-551-3191 or the Agency on Aging Rocky Mountain Development Council at 406-457-7368. As pointed out on the previous slide, COBRA is an alternative option to state plan benefits in retirement. Keep in mind, there is a cost difference between retiree benefits and COBRA. Rates are available for review at www.benefits.mt.gov, but the biggest difference is the period of time that you may remain covered. It's lifetime for the state plan retiree benefits versus 18 months of coverage on COBRA. If at separation from service you are not eligible to receive a retirement benefit under your applicable retirement system provisions, then you would only be eligible for 18 months of COBRA coverage. COBRA coverage is required by federal law and does provide the opportunity for the employees and/or their covered dependents to continue the group health insurance coverage that's due to a qualifying event, such as termination or employment loss of plan eligibility. If you retire and keep the state plan as a retiree, you and your dependents that are Medicare eligible must enroll in Parts A and B. And you will be automatically enrolled in the state plan Part D prescription drug coverage. You may not sign up for any other Part D coverage, because if you do, you will not be allowed to stay on the state plan benefits. Regardless of whether you enroll in Medicare Part B, the state plan coverage will process claims as if Medicare is primary. This could result in significant out-of-pocket increases to you. The 2020 Live Life Well incentive. Don't forget, the 2020 Live Life Well incentive deadline is October 31st, 2020. Don't miss out. Completing all the required Live Life Well activities and completing all self-reporting requirements will allow you to receive the Live Life Well incentive toward your 2021 contributions. Hopefully, you've already had a state-sponsored health screening. We've sent many reminders. Remember, you must complete all 3 requirements to earn any of the incentive. We've added extra screening opportunities at the Montana Health Center locations for October, but we can't guarantee you'll get in if you've waited. Incentive earned in 2020 will be applied toward 2021 state plan year contributions. You can visit our website at benefits.mt.gov/incentive for complete instructions and more details regarding the incentive. Participation in a state-sponsored health screening will automatically be reported to the MyActive Health website, but it does take about a month from the date of your screening to show up on the site. To earn the incentive, remember that you must self-report your nicotine status or alternate activity and your next step activity in the MyActive Health website. Even if you completed a wellness challenge such as the Governor's Stay Active Challenge, you still need to go self-report that you completed the activity in the MyActive Health site in order to earn the incentive. Additional instructions are available on our website at benefits.mt.gov/incentive. If you're all ready to self-report, you may go to myactivehealth.com/SOM, but we do recommend that you review all of the information on the benefits.mt.gov/incentive page before you go self-report your nicotine and next step activity. But remember, self-reporting your nicotine status use in the MyActive Health website is not the same as completing your open enrollment election, where you will also need to provide the nicotine use status for your tobacco surcharge. The 2021 Live Life Well Incentive Program will start November 1st, 2020. We want to make sure everyone is aware that for 2021, the third component of the Live Life Well incentive has changed. Please pay close attention to the next slide. Instead of completing a next step activity, you instead will complete and self-report that you've had a provider visit between November 1st, 2020 and October 31st, 2021. What is an eligible provider visit? It is an annual physical examination with a medical provider. This is an appointment where your doctor gives you a complete physical examination based on your age, gender, and other factors. This examination should include a discussion of your health screening results, so bring them along with you so your doctor can review those results with you during that appointment. If you have medications you take every day, your doctor may renew your prescriptions. You may choose a medical doctor that best fits your needs. Any kind of medical doctor is acceptable, from a family practitioner to a specialist, depending on who's most appropriate for you. Keep in mind, though, that regular benefits apply to this visit, and any additional services beyond the provider's time may incur extra expense. If you attend a provider visit at the Montana Health Centers, the out-of-pocket costs do not apply to any services provided. Also know that many of the next step activities will continue to be offered. They just won't be eligible activities in order for you to earn your Live Life Well incentive next year. If there's a reason you can't do any part of the Live Life Well incentive program, there are exceptions and alternatives available. This relates both to 2020 and to 2021. Contact HCBD to learn more. Here's a list of the Live Life Well contacts for the incentive programs. MyActive Health, where you self-report your nicotine status and next step activity, and next year will report your physician visit. Montana Health Centers for your health screening appointments, and our wellness contact information at HCBD for any questions on the program. This year's open enrollment period runs from October 25th to November 7th. You'll have from October 25th to November 7th to make your benefit elections for 2021 plan year online at benefits.mt.gov. Then you will select the Click Here to Start Open Enrollment button. But remember that click here to start open enrollment button won't appear on the website until the open enrollment system is available. This year, employees, legislators, and retirees will complete open enrollment elections online. It's imperative that all plan members complete their open enrollment elections if they wish to avoid the tobacco surcharge. Contact HCBD if you have any questions on completing your open enrollment elections. During open enrollment period, you can make changes to coverage like enrolling or waiving in the state plan. You can change life and long-term disability elections. You can also add or delete dependents from the plan. However, if you want the Vision hardware plan and plan to enroll or re-enroll in medical and dependent care flexible spending accounts, you must complete open enrollment to make those elections. In addition, and probably most importantly, you must complete your open enrollment election if you want to avoid the tobacco surcharge. If you do nothing, if you do not complete your open enrollment election, you will have the same medical, dental, life insurance, and long-term disability coverage that you currently have in 2020 for the entire 2021 plan year, unless you qualify for a special enrollment period at a later date. If you do nothing, you will automatically be charged the tobacco surcharge for yourself and, if applicable, to your covered spouse or domestic partner. Additionally, enrollment in medical or dependent care flexible spending accounts and the Vision hardware plan will terminate on January 1st, 2021. Medical FSA accounts with less than $550 at the end of 2020 will roll over into the 2021 benefit year. The open enrollment period is a time where you can elect to be joint core. If two state of Montana employees, spouse or domestic partner, share a dependent, then you should be joint core. Being joint core means that you have one shared family out-of-pocket max, and the rate for joint core is more effective than being employee children and employee only. For more information or to enroll, contact HCBD. To begin open enrollment, you need to access the HCBD website at benefits.mt.gov and then select the red button titled "Click here to start open enrollment." Remember, this red button will only be visible during open enrollment. You will complete open enrollment elections online or using your mobile device. The open enrollment booklet contains important information you need to know about completing your benefit elections, and the booklet will be mailed in mid-October, but is also available on the HCBD website. The open enrollment system will open the 25th of October, and all elections must be completed by November 7th. You'll access the open enrollment system via the HCBD website at benefits.mt.gov, and if you access that system via the State of Montana network, then you will not be required to register for an account and will be able to access the system using the single sign-on. Once you're logged in, you will select Start Here. Follow the instructions to complete your open enrollment elections. Remember, you have to complete the elections by November 7th, and the system will show you the number of days remaining to complete your enrollment. Once you're logged in, we do have several important reminders for you to read before you even begin your enrollment. So please take time to read all of those. Then, to start with, you'll be taken to an About You page. You will verify your information here, and we ask that you take a moment to review the information to assure it's correct. If you do have changes other than your marital status, there's a link provided, and you can update the demographic information in the MINE. If the information is correct, click Next, and you'll be asked to review your dependents for accuracy and may also add a dependent if applicable. Please remember, if you do add spouse life, the spouse must be added to the dependent screen even though you may not be adding the spouse to the state plan medical benefits. As you complete your elections, a running total can be seen at the top of the page. It reflects a total cost on a bi-weekly basis. There will be a summary at the end where you will be able to see a breakdown of the total bi-weekly cost. Then you will navigate to each benefit page and you will begin with medical. As a reminder, at the top of each page is an important information box regarding the benefit you're electing. Please read this information. This year, when electing medical coverage, you will also be prompted to elect your vision benefit. The vision election will either be basic vision or the vision hardware plan. Once one of the two options is selected, then you'll be allowed to continue. This example on the slide shows medical plan with basic vision selected. Next, you have to indicate your nicotine use. Read the instructions on this page carefully. You must select either yes, you are a nicotine user, or no, you are not a nicotine user for yourself, and if applicable, your covered spouse or domestic partner. If nothing is selected, you will not be able to move past this screen. It's important to note that if you are a nicotine user but you've completed an eligible alternative, you may select no. Please refer to benefits.mt.gov/tobacco surcharge for more information on the tobacco surcharge and alternative exceptions. This slide shows the employee and spouse's medical election summary, including basic vision. In addition, both are nicotine users. This slide shows the tobacco surcharge for each one listed. Remember, this is a bi-weekly amount, so the total for this employee and spouse is $30 bi-weekly and $60 monthly. Again, the slide shows bi-weekly. When you reach the vision benefit, remember the vision election has already been made back in the medical section. If changes are needed for this election, you need to click the back arrow and go to the medical selection and change the election. If you elected the medical plan with vision hardware, the premium will be listed on the next screen for you to review. You should continue through each benefit offered: dental, life insurance, long-term disability, and flexible spending accounts. Each benefit offering has important information you need to pay close attention to, and we ask again that you read the detail for each benefit offering as you complete your elections. You can review each of your elections and associated costs before you approve your benefit elections. It is extremely important to scroll all the way down and review this entire page and each of the elections. If changes are needed, you can click the Edit button next to the benefit, and you will then be prompted to review and modify the enrollment for that benefit. This summary page will also show you the tobacco surcharge and the Live Life Well incentive if you've earned it. At the bottom of the review page, you will see your cost, and you can see that it's a bi-weekly amount for the elected benefits. If you're satisfied with your elections, you can click on Approve. If at any time changes need to be made to your elections after you click Approve, you can do that up until open enrollment closes on November 7th. If you added any dependent or dependents, you will be prompted to provide documentation showing that they meet eligibility requirements of the state plan. And this page shows what documentation is required for each type of dependent. You can submit the documentation at this point by clicking on the Upload Now button, or you may scan an email at postal mail or fax the documentation. Dependent verification documentation has to be received by December 30th, 2020 for the dependent to be added to the plan effective January 1st, 2021. Once you agree, you will be taken to the confirmation page, and there you can print a copy of your elections by clicking on the Benefit Summary button. It's in the top right-hand corner of the screen, and we encourage you to print or save a copy. If you applied for any life insurance benefit coverage that requires evidence of insurability, or EOI, you can click on the highlighted box to begin that process. But please note that you will have to provide the group policy number 608088 when completing the EOI in the standard system. You have the option to download the My Choice mobile app on your mobile device or tablet to complete your open enrollment elections as well. This app is easy to download, install, and is available for you to use all year long for any updates and changes you might have. It's a great way to keep your address up to date so you don't miss out on any of our mailings. To access the app, first go to the HCBD website and click on that second green box that says Existing Member Benefit Changes. Once you click on that page, you will go into the enrollment system, and up in the right-hand corner, you will see Get Access Code for the My Choice mobile app. Click on Get Access Code. Then you will choose your phone operating system, and you will enter your phone number below. Once you get a text on your mobile device with the link to download the app, then the app will download and install. The app on your mobile device will then require an access code, and that is what you enter from step 2 of being on the website. This will then sync up your mobile application with the enrollment system, and you'll be able to complete all of your benefit elections using the mobile application. You will receive a notification of your 2021 benefit summary being finalized. After you've made your 2021 elections, though, you can access your summary at any time by logging into the enrollment system and clicking on Benefit Summary. When you receive the notification from us, please go in and make sure that we have captured the enrollment that you submitted correctly for 2021. And if you find an error, please contact HCBD before December 30th to get it fixed. Don't forget to print a copy. During and after open enrollment, other important documents do come from HCBD, which include the 2021 WRAP Plan document, or WPD, that outlines everything covered on our state plan and all the details. You get a summary of benefit coverage, which is a legal document required by the Affordable Health Care Act. It's a short summary of our plan. You receive a Medicare Part D credible coverage letter and a few other legal notices. Thank you for attending today. Please check out our website frequently for updates, because we post additional open enrollment tools, health screening schedules, flu shot schedules, incentive information, and much more. You may call us or email us with questions. We want to hear from you.